Welcome. Have you ever heard of a silent disruptor, a condition that quietly interferes with your body's autopilot? Today, we're diving deep into autonomic neuropathy, a disease affecting the autonomic nervous system, the unsung hero that controls many of our involuntary bodily functions. Join us as we unravel its complexities, from its causes to its management, and explore what it means to live with this challenging condition. So, what exactly triggers autonomic neuropathy? Well, the causes are quite diverse. Diabetes is a leading culprit, damaging nerves over time due to prolonged high blood sugar. Other potential causes include autoimmune diseases like lupus or rheumatoid arthritis, certain infections such as Lyme disease or AV, inherited conditions like familial amyloid polyneuropathy, and even exposure to toxins like alcohol or heavy metals. Sometimes the cause remains a mystery, labeled as idiopathic autonomic neuropathy. To understand autonomic neuropathy, we need to look at the pathophysiology. The autonomic nervous system is a complex network of nerves that regulates everything from heart rate and blood pressure to digestion, bladder control, and sweating. In autonomic neuropathy, these nerves become damaged, disrupting their ability to transmit signals effectively. This damage can occur to the nerve fibers themselves, or to the myelin sheath that insulates them. When these signals are disrupted, the organs and systems they control start to malfunction, leading to a wide range of symptoms. Autonomic neuropathy isn't a rare disease, but its prevalence varies depending on the underlying cause. For instance, it's quite common in individuals with long-standing diabetes, with estimates suggesting that up to 50% of people with diabetes will develop some form of autonomic neuropathy. The overall prevalence in the general population is harder to pinpoint due to the varied causes and potential for underdiagnosis. It can affect people of all ages and ethnic backgrounds. The signs and symptoms of autonomic neuropathy are as diverse as the functions controlled by the autonomic nervous system. You might experience orthostatic hypotension, a sudden drop in blood pressure upon standing, leading to dizziness or even fainting. Digestive issues are common, including gastroparesis, which delays stomach emptying, causing nausea, vomiting, and bloating. Other symptoms can include constipation or diarrhea, bladder dysfunction leading to urinary retention or incontinence, erectile dysfunction in men, abnormal sweating patterns, difficulty controlling body temperature, and even vision problems. The severity and combination of symptoms can vary greatly from person to person. Diagnosing autonomic neuropathy often involves a combination of physical exams, symptom evaluation, and specialized tests. Your doctor might check your blood pressure and heart rate while you're lying down and standing up to assess for orthostatic hypotension. Other tests can include an electrocardiogram (ECG) to evaluate heart function, tilt table testing to assess blood pressure regulation, sweat testing to measure sweat production, bladder function tests, and gastrointestinal motility studies to evaluate digestion. Nerve conduction studies can also help assess the extent of nerve damage. In some cases, imaging studies like MRI may be used to rule out other conditions. Autonomic neuropathy doesn't have distinct classifications in the traditional sense, but it is often categorized based on the affected organ systems or the underlying cause. For example, you might hear about cardiovascular autonomic neuropathy, referring to issues with heart rate and blood pressure, or gastrointestinal autonomic neuropathy, focusing on digestive problems. Diabetic autonomic neuropathy is another common term, used when diabetes is the underlying cause. Understanding which systems are primarily affected helps guide treatment strategies. While there's no cure for autonomic neuropathy, treatment focuses on managing symptoms and addressing the underlying cause. For orthostatic hypotension, lifestyle changes like drinking plenty of fluids, increasing salt intake, and wearing compression stockings can help. Medications can also be prescribed to raise blood pressure. Digestive problems are often managed with dietary changes, medications to improve stomach emptying, and anti-diarrheal or laxative medications. For bladder dysfunction, medications and catheterization may be necessary. Managing blood sugar levels is crucial for individuals with diabetic autonomic neuropathy. Physical therapy may also be beneficial for improving muscle strength and balance. Unfortunately, there's no guaranteed way to prevent autonomic neuropathy in all cases. However, for individuals with diabetes, meticulous blood sugar control is paramount in preventing or slowing the progression of nerve damage. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding excessive alcohol consumption, can also help. Early detection and treatment of underlying conditions like autoimmune diseases or infections can also reduce the risk. The prognosis for autonomic neuropathy varies depending on the severity of nerve damage, the underlying cause, and the individual's overall health. In some cases, symptoms may be mild and manageable, allowing individuals to live relatively normal lives. In other cases, the condition can be debilitating and significantly impact quality of life. Recent research is focused on developing new treatments to regenerate damaged nerves and improve autonomic function. For example, some studies are exploring the potential of stem cell therapy and nerve growth factors. Furthermore, advancements in diagnostic techniques are allowing for earlier detection and intervention,